Cystinosis is a lysosomal storage disorder which could have late onset systemic manifestations or complications such as muscle weakness, difficulty swallowing and breathing from neuromuscular perspective. We believe that the crystal deposition in different tissues, including muscles, can lead to what we call as clinical myopathy or weakness. The treatments like cysteamine facilitate the cystine transportation out of lysosomes, and nevertheless patients may continue to have a certain degree of muscle weakness, swallowing difficulty, or in more extreme cases the breathing muscles can be involved, which can be life-threatening. Patients may experience difficulty holding onto objects, dropping things, even having issues with buttoning, and some patients may even have prominent weakness in their facial muscles that could have severe limitations in activities of daily living and quality of life. I was initially introduced to CRF as a neuromuscular neurologist by my kind mentor, Dr. Eichler, who has worked with patients with cystinosis and lysosomal storage diseases. I was humbled immensely by the patients, their enthusiasm, and obviously CRF, which has been instrumental facilitating the efforts in finding a cure and solution for patients with cystinosis. We are hoping that by better understanding how this disease affects mechanics of swallowing or even breathing, we may be able to find targeted treatments or solutions to help patients' quality of life and function. Right now, we are applying modern swallowing evaluation techniques to find or identify these specific muscles or sequence of muscle activation that is most suitable for potential treatment or interventions. And on a different front, we are also trying to better characterize how muscles are affected in patients with cystinosis. We are hoping to define what is muscle resilience and regenerative capacity, and why some patients have more muscle involvement compared to the others. Are there genetic predictors that could help us identify these? And if it is possible to regenerate muscle tissue with stem cell or satellite cell technology, another collaboration that we're doing with medical school and developing treatments. We were able to actually look at the studies that we had collected from patients, and in a retrospective manner through support from CRF, and that helped us actually by looking at those using the novel swallow evaluation technique to identify or get closer to what are the main muscle groups or domains that could potentially be targeted for future treatment. It would be possible by certain type of training, which could be something very simple, speech therapy, or by targeting focal muscle treatment to improve swallowing function. So what we learn from this is going to have huge impact on other diseases with similar presentation, and there are many if you put them all together. The meaning I find from doing my work is essentially one word: hope. To give hope not only to improve but to thrive.